What is medical tourism? Actually, medical tourism started long centuries back in the world because many people, many citizens was traveling from his home country to the other countries, are looking for the best, higher standard and quality of healthcare treatment for themselves in order to be treated in a best quality with affordable prices. Today's, there is so many advanced countries like Turkey are receiving from many other countries where they are looking, their citizens are looking for treatment in different segmentation of healthcare to be affordable, high quality, high standard, and to be used high technology in order that they can return to their home country with their healthy situation. So for medical tourism, we name it who are looking from their home country to travel abroad, to travel to another country, to get the treatment and to be treated high quality, high standards, and affordable prices. Ladies and gentlemen, dear colleagues, dear partners, I would like to draw you the roadmap of our collaboration in between you and us. As a step one, you have several choice of cooperation. Turkish Healthcare Travel Council has a local representative offices in your region, which they do speak your native language, and they are ready to serve 7 to 24. That in order to help you, to assist you, and to communicate and to facilitate between you and our clinics and hospitals and local partners. As well as you can have the option that you can choose one of travel agent medical tourism facilitator from our participant, and you can build a cooperation and partnership, and you can refer your patient through them as well. And also as third options, you can choose and work directly with the clinic's international patient departments. That is totally up to you to choose one of this way of cooperation in order to refer your patient to Turkey and to follow up with your partner or with your with our offices locally based, and they are ready to collaborate. As a step one, you need to choose your partner with whom and which way that you would like to refer your patient. As soon as you share all the medical reports, MRI and all other medical information of your patient, your chosen partner will send to related hospitals all this information and will collect treatment plan and approximate cost and price for your patient who are going to be treated in Turkey. And they will come back to you with treatment plan and with cost. And after, you will negotiate with your patient, and if they agree to travel to Turkey, then your partner can arrange the appointment in a related hospital, which you agreed, that you can send your patient to start their treatment. Also, there is an option before they travel. If there is no clear medical reports and medical information about your patient, possibly we can arrange, or your partner, chosen partner, can arrange an online consultation between related doctors and your patient that in order they can understand what exactly and which kind of treatment need to apply for your patient. This option always available in our member of hospitals and participant in our exhibition. Of course, after referring the patient, your local partner or your chosen partner, either Turkish Healthcare Travel Council representative offices, either travel agencies, medical tourism agents, or the hospitals, will arrange your patient arrival transfers, accommodations, booking nearby hospital, and will follow up during the treatment, and they will help and assist your patient in order to feel comfortable during the treatment period. Also, as Turkish Healthcare Travel Council, we have appointed medical directors working closely with our representative offices, and they are following all our referred patients through the THTC, Turkish Healthcare Travel Council offices. They are following locally in the same city the treatment process, and they be always in touch with the patient and the companions and with family to give them more comfort and more way of feeling at home, and to be followed up by our medical directors to make their life easier and treatment easier. Within this cooperation, after the treatment completed, of course, according to your partner agreement, either with our offices, representative offices, or with your new partner travel agent or the clinics, you may have kind of an agreement of follow-up fee for your referred patient. That in order the post-operation that you can able to follow up and keep contact with your patient, and also to be sure that your referred patient happy and return back home with treated and come back to their health. All your partner, including our offices, travel agencies, medical tourism agents, and the clinics, of course, they are ready to award your work with success of treatment and also with follow-up fee, that in order to cover your valuable time which you spare during this period. So we are always welcoming all our partners to collaborate with us in this roadmap. And also, as I mentioned, that possibly you can collaborate with other options of medical tourism agent or directly with the hospital and clinics. This is totally up to your choice, whether you will cooperate in your country with our offices, or internationally you can collaborate with our medical tourism agent and the clinics. This is our roadmap of cooperation, and you can able to follow up this procedure, and you can build cooperation in between our exhibitors and yourself. Thank you very much once again joining our event.
Hello everyone. Today my name is Cem Aslan. Diğer kişi gitti ama. My name is Cem Aslan. Today we will talk about breast aesthetic surgery. We can divide breast aesthetic surgery in two main headings. One of is female breast aesthetic surgery. The other one is, of course, male aesthetic surgery. Today, we will talk about female breast aesthetic surgeries. The first topic is breast reduction. Breast reduction is not only an aesthetic surgery, actually. Macromastia or large breast volume, not only an aesthetic problem for women, it's also a physical problem for most of the women. It causes neck pain, back pain, and also it makes skin rashes. So breast reduction surgery is not only an aesthetic surgery, it also heals some physical problems that I told. What we make in breast reduction surgery, we take excess fat, breast tissue, and skin, and then we reshape the breast in a higher position. So we make breast lifting and breast reduction together, actually. Of course, most of the breast operation, actually most of the operations, we want to from patients to stop smoking before the surgery. After the surgery, we will give you a special bra. You will use it for 1 month. The end of the first week, you can go your daily works. Of course, all of the operations have some limitations, some risks, but breast reduction surgery may be the one of the least has one of the the breast reduction surgery has very low risks, very low percentage of complications. I want to. Şimdi breast reduction bitiyor ama aynı şeyler bahsediyor sürekli. O yüzden devam etmem. Bunu anlatayım mı? Tamam. Breast augmentation is one of the another operation in breast aesthetic surgery. Actually, breast augmentation is one of the most popular operation in worldwide. The goals today, we think that surgeons think that the most powerful method or the gold standard method is making this operation with using silicone implants. Also, we can make fat injection to make breast volume larger, but the gold standard method is using silicone implants. We can put the silicone implants in 3 planes. We can put the silicone under the breast tissue, under the chest bone muscle, and under the chest muscle sheath. We call it fascia. Of course, we decide the breast pocket before the operation in physical examination. All patients have own physical characteristics. So we decide the pocket, implant pocket to patient body type, breast tissue thickness, and also, of course, patient wishes. Another important thing in breast operations is implant size and implant types. We have 2 main implant types, natural and round. Natural, it's like water drop, and round implant, of course, round. Also, these implants have another sizes like high profile, extra high profile, moderate profile, or low profile. Before the operation, we talk with our patients to decide which one we will use in operation, of course. The shape is the most of size. I'm sorry, size is the most important thing in this type of operations. The final decision for implant sizes, of course, we decide our final decision in operating table. But before the operation, we will talk the sizes with patients, also to patients' body conditions, of course. After the breast augmentation, the most problematic complication is infection. But nowadays, the very small percentage we will see infection. I mean, only 2 to 3 percent, 2 to 3% of the operations we see infection. Why infection is problematic? Actually, it will not hurt our body, but if there is a deep infection, we must remove the implant, and a couple of months later we can put another implant actually. For long term, after a couple of months, for long term period, we can see actually the most problematic thing is capsule contractor, but new implant types and new implant types, also silicone types, cohesive gel silicones for, I mean, again, it's very low percentage. I think the last one for female breast is breast lifting surgery. After pregnancy or after excessive weight loss, or only for patient characteristic body conditions, we can see sagging in breast tissue. In breast lifting surgery, we will take the excess skin, and again, like breast reduction surgery, we will reshape the breast in a higher position. The main problematic thing in this or lifting surgery is use an implant or not. Again, we will, of course, we will, when we see a patient's breast tissue, we can know if we must use a silicone implant or not. But again, we will talk with implant choice to patient. If patient desire an implant, we will put implant, and then, of course, simultaneously, the same operation, we will lift the breast. We are waiting dear patients to our hospital. See you. I hope see you later. See you soon. Yeah, I hope see you soon.
Hello everyone, I'm Surgeon Anil Aspak. I work as a plastic surgeon in the private hospital Ecoli in Izmir city. Today I will tell you about rhinoplastics, which is a plastic surgery of nose. Rhinoplastic is one of the most widespread types of plastic operations. The idea is to make the patient, or more specifically their nose, more beautiful, and at the same time, if the patient has some problems with nose breathing, we are able to solve that with rhinoplastics as well. In our hospital, Ecoli, I use the closed technique for the operations. The idea of the closed technique is to have no cuts on the nasal tips, and we are this way saving all the capillary structures and nervous structures. The patient has no scars after the operation, and after the use of the closed technique, patients quicker restore and come back to normal life. Are there any risks associated with plastic operations? Yes, of course, just like in any other types of operations. The most widespread after effect in the early period is swelling and bruising, but thanks to our planning and thanks to the preference of the closed technique, most often in 48 hours our patients lose all those symptoms. We can discharge our patient on the same day. On the 4th day we remove the tampons. On the 7th day we remove the dorsal clamps, and our patients fully recover in 10 days. I would like to share the photos of some of our patients. This our patient has a nasal tip which was slightly drooping, and there was a little dorsal hump. The nose was disproportional compared with the rest of the face. We used a closed technique, and here you can see the result in 3 months. The woman has the ideal nose angle, about 110 degrees. We were able to accomplish the desired result. Also, we managed to achieve the natural transition on the nasal dorsum. For men, the nose angle should be 90 degrees. And here you can see one more patient which had a drooping nose and also dorsal hump. We managed to remove that drooping nasal tip and to remove the dorsal hump. Here is the next patient. You can see a disproportionate nose with a dorsal hump and a drooping tip. We used the closed technique. There are no traces of the operation on the nose, and we managed to achieve the natural look. No one needs to be afraid of nasal surgery anymore, and thanks to the closed technique our patients are able to recover much faster. Thanks to the data of ISAPS, the International Organization of Plastic Surgeons, Turkey is among the top 10 countries with the largest number of plastic operations. Turkish plastic surgeons perform such operations almost daily and have huge experience. That's it from me, and I hope you found answers to your questions. I'm looking forward to meeting you in Turkey.
Okay. You, Kalsın. Hello, I'm Dr. Arif Aydın from Turkey. I'm a plastic surgeon. I'm a board-certified plastic surgeon with 12 years of experience. Now I will talk about Brazilian butt lift surgery. So what is a Brazilian butt lift? This is an operation that do fat transfer from the other areas of the body, like stomach, waist, hips, to the buttocks. It's popularly increasing in the world. This procedure starts with liposuction and ends with fat transfer. If you don't have enough fat in your body, we can use buttock implants as well. Buttock implants are placed in the muscle, in gluteal muscle. And sometimes we use both fat injection and Botox implants for projection. So, things to consider about these surgeries. If we use implants, there is a rare risk of capsular contracture. This is a situation that can be seen in any type of implants, like breast implants, calf implants, and so on. It's a very rare condition. About the Brazilian butt lift surgery, we use own fat of the patient's body, so we don't usually see a reaction for that. If the patients are healthy, keep on regular diet and exercise, and have enough fat store in their body, they are good candidate for this surgery. We want the patients not to have recent surgeries or any infections. And the weight of the patients must be stable at least for 3 months before the surgery. So before, the patients usually don't have enough projection of their buttocks, and they have depressions on the gluteal area. So when we do fat injection, we can create a round, better curve and better projection. So this is an example of one of my patients. This is a long-term results. She sent me the pictures. We took the fat from her stomach, from her belly, and from her back, and we injected the fat into her gluteal area. So now we have a better curve, better shape. You can see in the before picture there are depressions in the waistline, the gluteal area. Now we have a more round shape, a better curve. We want the patients to wear a garment, a special garment that we provide them here for 3 or 4 months. That will be enough. Usually stay in the hospital is 1 night or maybe 2 nights, and we want them to stay in Turkey like 1 week, but they can return to their daily activities in 3 or 4 days. It's not really a painful surgery. They can walk, they can stand up and walk at the same day of the surgery. After 3 hours of the surgery, they can stand up, walk. If they want, they can go outside. Of course, there will be some bruising, some swelling, but they will all be gone. So we start to see the results immediately after surgery, but for the final results, after all the swelling goes, we almost see after 1 month the final result. So this is another example of one of my patients. This is just the 3rd day after surgery. So we made liposuction to her back, to her stomach, to her belly, and we put the fat into the gluteal region. So as you can see in the before picture, her buttocks are more flat, and after the operation, this is more round shape that we desire. She's comfortable. This is the 3rd day she came for control. Everything is all right, and she returned to her country the 7th day after surgery. This is a comfortable operation. The patients benefit a lot. But one thing, the viability of the fat differs from person to person. In some patients, most of the fat survive. In some patients, some of the fat will resorb. For sure, some of the fat will resorb. But if we see a resorption more than we expected, we can already redo the surgery. So this was my presentation. Thank you for listening. You are all welcome to our clinic.
Турция – новая точка на карте мировой медицины. Ее расположение идеально. Она находится на стыке 3 континентов – Азии, Африки и Европы. Инновационное оборудование, квалифицированный персонал и доступные цены. Все это за последние 5 лет позволило Турции войти в 3 стран-лидеров по медицинскому туризму. Впереди только США и Германия. Самое тяжелое заболевание. Самые сложные операции. И своевременные вмешательства. Восстановление. И реабилитация. Продолжение рода. Красота и молодость. Весь спектр медицинских услуг вы получите в Турции. Доверьте нам самое ценное – ваше здоровье. Каждый заслуживает свое маленькое счастье, но не всем это удается. У 5% мужчин и женщин, у 48,5 миллионов пар диагностировано бесплодие. Эта проблема острым вопросом стоит в современном обществе. И выход есть – это экстракорпоральное оплодотворение. Только в Турции ежегодно проводится более 50 тысяч процедур при успешности около 65%. Почему люди со всего мира выбирают именно это место? Благодаря своим инновациям Турция предлагает новые методики вспомогательной репродуктивной технологии, которые помогают повысить шансы на удачное оплодотворение. Даже у женщин со сниженным овариальным резервом. Индивидуальный подход и подбор протокола для каждой пары с использованием прогрессивных методов ЭКО. В случае истощения овариального резерва или наличия мужского фактора бесплодия также существует возможность донорства. В программе донорства участвуют только сертифицированные доноры, проверенные на наличие инфекций, генетических и психологических заболеваний. В случае необходимости проводится предимплантационная генетическая диагностика, позволяющая исключить генетические нарушения эмбрионов и достигнуть главной цели – рождения здорового малыша в семье. Ведь каждый заслуживает свое маленькое счастье. И никаких «но». Успех борьбы с онкологическими заболеваниями много в чем зависит от ранней диагностики. Турция – страна, в которой за последние 10 лет уровень медицины вырос в несколько раз, а онкология стала приоритетом в лечении. Цены более доступные, чем в США и Европе. Турецкие нейрохирурги входят в первую 5 команд в мире по использованию технологии гамма-ножа. Она позволяет убивать опухолевые клетки без оперативного вмешательства путем высокоточного радиационного облучения, существенно сокращает период реабилитации и предотвращает осложнения. Также в Турции практикуют выведение пациента из анестезии прямо во время операции на мозге. Ему задают вопросы, тем самым проверяя работу речевого аппарата, и проводят МРТ, чтобы убедиться, опухоль полностью удалена. Для опухолей простаты и женских внутренних половых органов радиоактивные лучи доставляются по специальным пластиковым трубкам непосредственно в опухоль. Эта технология позволяет сократить количество сеансов облучения и предотвращает образование ожогов. Рак – это диагноз, а не приговор. Травмы опорно-двигательного аппарата, головного и спинного мозга, параличи и детский церебральный паралич. Вот неполный список диагнозов, когда реабилитация так же важна и необходима, как и основное лечение. Инновационное оборудование, квалифицированный персонал и индивидуальный подход. Всевозможные вспомогательные процедуры и дополнительное лечение. Физические нагрузки для окончательного выздоровления и профилактики. Но главным преимуществом турецкой восстановительной медицины является роботизированная реабилитация. Благодаря роботу-тренажеру человек, который долгое время был прикован к постели, может ощутить вкус ходьбы и даже почувствовать спортивный азарт с помощью компьютерной игры-симуляции. Параллельно с разработкой конечностей пациентов учат, как использовать восстановленные навыки движений в быту. Доверьте нам самое ценное – свое здоровье. И давайте шаг за шагом двигаться вперед. Уровень трансплантологии в Турции один из самых высоких в мире. Ежегодно здесь проводят более 5000 операций с пересадки органов. Это больше, чем в любой стране Евросоюза. Среди лидеров – трансплантация печени, почек и костного мозга. Как взрослым, так и детям. Трансплантация печени и почек в Турции возможна только от доноров-родственников, хотя бы 4-го колена. Для пересадки костного мозга сначала ищут доноров-родственников. Если таких нет, можно обращаться в донорские банки. Для пересадки роговицы пациенты могут воспользоваться услугами Национального банка доноров Турции.
I am interested in especially bone marrow transplantation in children. We can do.
Трансплантация стволовых клеток – еще одно направление, которое быстро развивается в Турции. Терапия стволовыми клетками показывает хорошие результаты при таких серьезных заболеваниях, как детский церебральный паралич, травмы спинного мозга, цирроз печени и некоторых аутоиммунных заболеваниях. Для многих пациентов это, если не шанс на выздоровление, хотя бы на улучшение качества жизни.
I have been working on stem cell for the last 20 years, just stem cells. Today I would like to inform.
Медицинский туризм в Турции. Доверьте нам самое ценное – ваше здоровье.
The art of medicine is the heritage of Anatolia. You are in Turkey, the place where the first hospital of the world was founded and Hippocrates was born and grew up. In these lands, we treated the diseases with water, precious plants, and music. Our thousands of years of medical tradition reached a new level today with the advanced technology. But hospitality of Turkey and its air, useful for both soul and body, is still the same. Turkey attracts everybody by its nature, history, dynamic social life, as well as the best and most effective treatment possibilities since long time. With its high-standard hospitals and doctors known around the world, Turkey maintains its specialty of being the center of health of the region since long time. Because Turkey is at the intersection points of its continents. It is located at the center of Europe, Balkans, Russian, Middle East, and North Africa. Approximately 1 billion people can arrive at Turkey only with a few hours' flight. Turkish Airlines carries millions of people from 120 countries and 290 cities to Turkey by direct flights. There is a reason why so many people prefer Turkey. Because Turkey offers the newest technology treatment systems at the same time with the world. With its competitive price policy, it is among first choices of those who are looking for the top quality service with optimum prices. Turkey provides comfort with its high-standard hospitals during healing process, with its hospitals having Center of Excellence Awards and Joint Commission accreditation certificates. It maintains its privileged place in the region. An experienced team with 724 specialist services and air ambulances works for satisfaction of the guests. Experienced Turkish doctors who break grounds all around the world continues to control their patients after treatment. Thus, Turkey takes place on the top 3 in the world health tourism destinations. Turkey accommodates patients from 144 countries every year in the risky treatments and operations required high technology. It uses robotic surgery. Marrow, organ, and stem cell transplantations are performed by awarded doctors through the latest technology. With innovative treatment systems such as inorganic organ production and transplantation, life-saving results are achieved. There is a progressive vision behind this success. Mustafa Kemal Atatürk, the founder of modern Republic of Turkey, started this vision by saying, "Entrust me to Turkish doctors." Today, Recep Tayyip Erdogan, President of the Republic, is still treated by Turkish doctors. Since the early years of the Republic, young doctors have completed their postgraduate education abroad. Turkish health sector has made a big progress with an investment of $30 billion in 15 promising successes in the treatment of common cancer and cardiovascular diseases. A complete healing is achieved in a short time by non-surgical treatments of the brain tumors. Children needing treatment in different branches such as blood diseases, marrow transplantation, heart surgery, brain tumors, etc. are also achieving health again in Turkey because the best treatment methods are applied with a smiling and kindly approach. Services allowing the children to have a pleasant time facilitate treatment processes. Children, our most precious existences, are deserving of this special attention. Also, there are many treatment alternatives for those who want to have children in Turkey. Couples are enjoying having children and growing their family with infertility treatment, advanced genetics applications, and in vitro fertilization methods. Turkey is where the civilizations was born and continue. With its active city life, untouched nature, and majestic history, Turkey transforms your treatment process into a comfortable and pleasant holiday. .375 member organizations, which adopted ethical principles of Turkish Healthcare and Travel Council, work for happiness of the guests. We are at the intersection point of hearts and continents. Hope to see you soon. Right choice for your life. Turkey. Healing generations for centuries.
Ladies and gentlemen, dear colleagues, dear partners, I would like to draw you the roadmap of our collaboration in between you and us. As a step one, you have several choice of cooperation. Turkish Healthcare Travel Council has a local representative offices in your region, which they do speak your native language, and they are ready to serve 7 to 24. That in order to help you, to assist you, and to communicate and to facilitate between you and our clinics and hospitals and local partners. As well as you can have the option that you can choose one of travel agent medical tourism facilitator from our participant, and you can build a cooperation and partnership, and you can refer your patient through them as well. And also as third options, you can choose and work directly with the clinic's international patient departments. That is totally up to you to choose one of this way of cooperation in order to refer your patient to Turkey and to follow up with your partner or with your with our offices locally based, and they are ready to collaborate. As a step one, you need to choose your partner with whom and which way that you would like to refer your patient. As soon as you share all the medical reports, MRI and all other medical information of your patient, your chosen partner will send to related hospitals all this information and will collect treatment plan and approximate cost and price for your patient who are going to be treated in Turkey. And they will come back to you with treatment plan and with cost. And after, you will negotiate with your patient, and if they agree to travel to Turkey, then your partner can arrange the appointment in a related hospital, which you agreed, that you can send your patient to start their treatment. Also, there is an option before they travel. If there is no clear medical reports and medical information about your patient, possibly we can arrange, or your partner, chosen partner, can arrange an online consultation between related doctors and your patient, that in order they can understand what exactly and which kind of treatment need to apply for your patient. This option always available in our member of hospitals and participant in our exhibition. Of course, after referring the patient, your local partner or your chosen partner, either Turkish Healthcare Travel Council representative offices, either travel agencies, medical tourism agents, or the hospitals, will arrange your patient arrival transfers, accommodations, booking nearby hospital, and will follow up during the treatment, and they will help and assist your patient in order to feel comfortable during the treatment period. Also, as Turkish Healthcare Travel Council, we have appointed medical directors working closely with our representative offices, and they are following all our referred patients through the THTC, Turkish Healthcare Travel Council offices. They are following locally in the same city the treatment process, and they be always in touch with the patient and the companions and with family to give them more comfort and more way of feeling at home, and to be followed up by our medical directors to make their life easier and treatment easier. Within this cooperation, after the treatment completed, of course, according to your partner agreement, either with our offices, representative offices, or with your new partner travel agent or the clinics, you may have kind of an agreement of follow-up fee for your referred patient, that in order the post-operation that you can able to follow up and keep contact with your patient, and also to be sure that your referred patient happy and return back home with treated and come back to their health. All your partner, including our offices, travel agencies, medical tourism agents, and the clinics, of course, they are ready to award your work with success of treatment, and also with follow-up fee, that in order to cover your valuable time which you spare during this period. So we are always welcoming all our partners to collaborate with us in this roadmap. And also, as I mentioned, that possibly you can collaborate with other options of medical tourism agent or directly with the hospital and clinics. This is totally up to your choice, whether you will cooperate in your country with our offices, or internationally you can collaborate with our medical tourism agent and the clinics. This is our roadmap of cooperation, and you can able to follow up this procedure, and you can build cooperation in between our exhibitors and yourself. Thank you very much once again joining our event.
Evet, bugün konumuz kireçlenmeler ve bunlardaki cerrahi tedavilerimiz, özellikle protezler. Kireçlenme hepimizin bildiği gibi eklemlerdeki kıkırdak kaybı. Dolayısıyla eklem olan her yerde kireçlenme olur. Bugünkü konumuz daha ziyade yük taşıyan büyük eklemlerdeki kireçlenmeler. Kıkırdak kaybı, nasıl ki bütün dokularımız yaşlanıyor, kıkırdaklarımız da yaşlanıp kıkırdak kaybına yol açar. Bu da kireçlenmeye yol açar ama tek sebep bu klasik kireçlenme değil. Geçmişte geçirilmiş travmalar, çocukluk çağındaki bazı hastalıklar, doğumsal hastalıklar, doğumsal kalça çıkığı gibi ya da bir takım metabolik hastalıklar, romatizmal hastalıklar ki ankilozan spondilit ve romatoid artrit bunlara örnektir. Bunlar synovia'dan başlayıp eklemleri bozarlar ve kireçlenmeye yol açarlar. Başlangıçta konservatif tedavi, fizik tedavi, kasları kuvvetlendirme gibi yöntemler kullanılırken daha sonra bunlarla cevap vermeyenlerde eklem içi enjeksiyonlar ya da aks bozukluklarından bir takım osteotomiler yapılabilir. Fakat eni sonu proteze gider bu hastalar. Protez suni bir eklem. Metal, polietilen, seramik gibi komponentleri olan malzemeler. Klasik kireçlenmelerde, standart vakalarda çok büyük problemler yok. Ama şöyle bir hasta karşımıza geldiğinde yapılacak şeylerin çok dikkatli olması lazım. Bu hastamızda geçmişte bir osteotomi yapılmış. Burada görüldüğü gibi. 50'li yaşlarda diğer tarafına protez yapmışız. Burada yüksekte kalça çıkığı, bir de osteotomi, çok iyi bir ameliyat öncesi planlama gerekiyor. Zaten protez ameliyatlarını öncesinde hastayı ameliyat etmeden bütün planlamasını, ameliyatı birebir yaşamak gerekiyor. Ameliyat öncesi yani pre-op planlama bunlardaki en önemli, iyi sonuç almamıza sebep olacak en önemli kriter. Bu hastamızda da biz sol taraftaki protezini yaptıktan sonra klasik standart protez, sağ taraf hem yüksekte kalça çıkığı, hem kısalık var, hem osteotomi yapılmış. Bu aksı düzeltmemiz gerekiyor. Kalça merkezini aşağı indirmemiz gerekiyor. Beraberinde kısalığı halletmemiz gerekiyor. Burada yaptığımız osteotomide kaynaması gerekiyor. Femurun medullası dar olduğu için özel tip bir protez kullanmak gerekiyor. Bütün bunların hepsini ameliyat öncesi planladık. Bu hastamızın planlamasını yaptıktan sonra geniş bir gevşetmeyle başı kestik. Kalça merkezine orijinal yerine indirip asetabular komponenti yerleştirdik. Açılı keserek bir osteotomi ile aşağı indirdik. Protezimizi koyduk. Osteotomi hattını bu şekilde görüldüğü gibi tespit ettik. Postop erken dönem. Bu da yaklaşık 3 yıl sonraki hali. Burada görüldüğü gibi osteotomi hattımız kaynamış. En ufak bir sorun yok. Hastamızın kısalığı düzeldi. Yaklaşık 7 santim kısalığı vardı. Kısalığı düzeldi. Yürüyüşü de düzeldi. İyi bir fizik tedavi ki bu hastalarda olmazsa olmaz, hastanın ameliyat sonrası iyi bir fizik tedavi görüp hem uzayan kasları hem de yıllardır kullanmadığı için zayıflamış olan kalça çevresi kaslarını mutlaka kuvvetlendirmek lazım. Bu da ameliyatın bir parçası. 3 yılın sonunda hiçbir sorun yok. Bazen de böyle bir vakayla karşılaşabiliriz. Kilolu bir hastamız 3-4 defa protez ameliyatı olmuş, revize olmuş. Bir dönem sementli yapılmış. Buradan sementleri dışarıya kaçmış. Hastanın protezinin alt kısmı kırılmış, gevşemiş, yürüyemeyen bir hasta. Yukarıda storakanterin üst kısmında da gördüğümüz gibi ciddi bir kemik kaybı var. Burada planlarken tabii protez çıkartılacak, buradaki sementi temizlenecek. Fakat burada ciddi bir kemik defektimiz var. Buna da bir çözüm bulmamız gerekiyor. Buna da allograft kullanmaya karar verdik. Bu da ameliyat sonrası bir modüler protez kullandık. Asetabulum gevşemediği için asetabulumu değişmedik. Sementi temizledik. Medullayı oyduk. Uzun medüller bir stem koyduk. Allograft koyduk. Araya spongiöz kemiklerle destek olduk ve cable'la tespit ettik. Bu da lateral görüntüsü. Ameliyat esnasında açtığımızdaki görüntü. Çıkarttığımız fragmanlar. Cable'la graft tespiti. Bu da çıkarttığımız sement. Ameliyat öncesi filmler ve son hali. Tabii bunlar, bütün vakalarımız böyle kötü değil. Bunlar ekstrem vakalar. Ama zaten standart vakalarda problem yok. Standart vakalarda yapılması gereken çimentosuz yapılıyorsa medullanın iyi doldurulması, özellikle femoral anteversiyon ve asetabular anteversiyonun totalde 15-25 derece arasında tutulması, press fit kullanılması çimentosuz kullanılıyorsa, asetabulumun açılarının düzgün ayarlanması, bunlar önemli detaylar. Boyunun iyi ayarlanması, bu da çok önemli. Çimentosuz protezler kullanıyorsanız mutlaka press fit hem asetabulumun, metal bekinin hem de femoral sistemin press fit konulması önemli. Burada kullandığınız yöntemde çimentolu ya da çimentosuz yapabilirsiniz. Neye göre çimentolu ya da çimentosuz kullanıyorum? Çoğunlukla ameliyat esnasında karar veriyorum buna. Oyarken kemiğin direncinin iyi olduğunu düşündüğüm tüm hastalara asetabular ve femoral çimentosuz yapmayı tercih ediyorum. Ama çimentolu protezlerde de uzun yıllar sağ kalım, eğer iyi bir çimentolama yapılırsa uzun yıllar sağ kalım gösterilmiş. Dolayısıyla birinin diğerine üstün olduğunu iddia etmek benim açımdan çok doğru değil. Eğer kemik kalitesi iyi değilse, romatizmal bir hastalığa bağlıysa, genellikle romatoid artritte özellikle femoru stemli yapmayı tercih ediyorum. Kullandığınız malzemede alışkın olduğu malzemeyi kullanması her zaman iyidir insanların, hekimlerin. Protezin tipi, dizaynı çok önemli değil ama malzeme, yapıldığı malzeme önemli. Ben genellikle polietilen seramik tipi, çimentosuz, hidroksiapatit kaplı protezleri tercih ediyorum. Bunların sonuçlarının diğerlerine göre biraz daha iyi olduğunu düşünüyorum kendi deneyimim içinde. Seramik de kullanıyorum ama çok genç hastalarda bazen seramiği tercih ediyorum ama seramikte hasta yürürken bazen ses çıkıyor, rahatsız edici. Benim başıma da geldi. O yüzden polietilen seramiği daha çok tercih ediyorum. Seramik kırılması da bir hastamda oldu. O da literatürde biliniyor. Ama çok büyük miktarlarda bir seramik kırılması görmedim. Sadece bir hastamda gördüm ki yaklaşık 100'ün üzeri seramik yaptığım hasta var. Kalça için giriş yolları yine sizin alışkın olduğunuz yöntemler. Yani posterior mu gireceksiniz, anterior mu gireceksiniz, lateral mi gireceksiniz? En iyi yöntem sizin alışkın olduğunuz yöntem. Ben genellikle lateral girip gluteus medius'u parsiyel olarak kesip önden ulaşmayı tercih ediyorum. Böylece siyatik problemlerden ve çıkıktan uzak kalıyorum. Hemen hemen yaptığım vakalarda pek protez çıkığı görmedim. Daha sonra tamir ederken de, kapatırken de gluteus medius'u mutlaka yerine dikip kuvvetli bir şekilde tamir edip hastanın bir abduktor yetmezliği olmasını önlemeye çalışıyorum. Hemen ertesi gün tam yük verip yürütüyorum ve mutlaka fizik tedavi ekliyorum. Bunun dışında dizlerle ilgili de söylemek istediğim şeyler şunlar. Klasik olarak diz protezleri de son derece efektif ameliyatlar. Hemen hemen diz ve kalça protezleri hasta memnuniyetinin en yüksek olduğu protezler. Normalde diz protezi bir kemik ameliyatı değil, bir yumuşak doku ameliyatı. Özellikle eklem çizgisini korumak, bağları dengeli olarak tutmak ve kalçadan farklı olarak dizde bozuk olan mekanik aksı mutlaka düzeltmek gerekiyor. Bunları yaparken bazen çok fazla kemik rezeksiyonu yapmak gerekebilir. Bunlardan da kaçınmak gerekiyor. Eğer böyle bir hastanız varsa bu hastalara primer de olsa bir revizyon tipi protez kullanmayı düşünmek lazım. Tabii bu da ekstrem bir vaka. Gördüğünüz gibi evre 4 bir diz kireçlenmesi, medial eklem aralığı hiç kalmamış, ileri varusu var, lüksü olmuş neredeyse diz. Böyle bir hastada da yine ameliyat öncesi planlama önemli. Eklemi düzeltmek lazım. Beraberinde uzun zamandır basıp yürümeyen bir hasta olduğu için mediali desteklemek lazım. Ben bu tip hastalarda primerde yapsam mutlaka bir tibiaya stent koyup yükü intramedüller kanala verip medial tarafı korumaya çalışıyorum. Bunlar da lateral görüntülerimiz. Ben kendi deneyimim içinde bu tip ileri varus hastalarını beraberinde yandaş bir hastalığı yoksa ve yani 75 yaş altıysa mutlaka iki diz bir arada yapıyorum. Çünkü ileri varusta bir dizi düzelttiğinizde diğer diz ameliyatına kadar ameliyat ettiğimiz dize çok fazla yük biniyor. O düz bir hale geliyor. Diğeri hala varusta olduğu için bir boy farkı oluşuyor ve hasta bu durumdan çok mutsuz oluyor. Dolayısıyla ben bu hastayı da tek seansta bilateral yaptım. Ameliyat sonrası görüntümüz, erken dönem görüntümüz bu. Buna bir stent kullandım ve kısıtlayıcı bir insert kullandım. Böylece medial ve lateral bağlarımdaki dengesizlikleri de ortadan kaldırdı. Ve gördüğümüz gibi aksımız düzeldi. Diz protezlerinde aksı düzeltiyorum mutlaka. Varus, valgus varsa. Eğer ileri varusu varsa, gecikmiş vakaysa arka çapraz bağ kesen tipte bir protez kullanmayı ve kısıtlayıcı tarzda bir insert kullanmayı tercih ediyorum. Hasta obezse mutlaka stemli bir protez kullanıyorum. Bunlarda da ameliyat öncesi mutlaka boy grafisini çekip mekanik aksları ölçerek ameliyat öncesi ne kadar düzeltme yapacağıma karar veriyorum. 75 yaş altı yandaş hastalığı olmayan hastalara çift taraflı protez tercih ediyorum. Yoksa 75 yaş üstüyse veya yandaş bir hastalığı varsa bunlara tek protez 6 hafta sonra da diğerini yapıyorum. Çift taraflı protezlerde altın standart anestezi tipi olarak spinal epidural kombine anesteziyi tercih ediyorum. Ameliyat sonrası da epidural kateteri biraz daha kullanıp ağrı tedavisini oradan yapmayı tercih ediyorum. Ameliyat sonrası hemen ertesi gün bastırıp ikinci gün merdiven egzersizlerine başlıyorum. Diren genellikle kullanıyorum. Turnike altında yapıyorum. Protezlerimi yerleştirdikten sonra, sementim kaynadıktan sonra, donduktan sonra mutlaka turnikeyi açıp kanama kontrolü yapıyorum. Cildi ondan sonra kapatıyorum. Kullandığım dizde, kalçada hep sementsiz kullanırken dizde de genellikle sementli tercih ediyorum. Benim hastalarımda uzun dönem takiplerimde sementli sonuçlarım biraz daha iyi. O yüzden dizde sementli protezi tercih ediyorum. Burada da klasik kireçlenmenin dışında yine romatizmal hastalıklarda geçirilmiş, çocukluk çağında geçirilmiş konjenital anomalilerde, Blount hastalığında vesaire kireçlenme oluyor. Bunların tedavisinde sonuçlar çok fazla değişmiyor. Ama erken yaşta varusu varsa yüksek tibiyal açık ya da kapalı yüksek tibiyal osteotomilerle artrozu geciktirmek mümkün. Hastanın şikayetlerini gidermek mümkün. Patella ile ilgili sıkıntılarda proksimal ya da distal dizilimi düzelterek kireçlenmeleri önlemek mümkün. Dizde son zamanlarda mezenkimal stromal hücre tedavisiyle iyi sonuçlar bildiriliyor. Özellikle göbek çevresinden alınan yağdan yapılan kök hücre uygulamalarının ilgili iyi sonuçlar var. Ama bunlar sadece protez ameliyatını geciktiriyor. Benim şu anki gözlemim. Uzun vadede mutlaka tabii daha iyi yöntemler bulunacak. Ama daha iyi yöntemler bulunana kadar şu ana da elimizdeki en iyi yöntem bozulmuş dizleri, kalçaları, hastanın hayat kalitesini bozan, yürümesini engelleyen bu eklemleri protezle değiştirmek.
Турция – новая точка на карте мировой медицины. Ее расположение идеально. Она находится на стыке 3 континентов – Азии, Африки и Европы. Инновационное оборудование, квалифицированный персонал и доступные цены. Все это за последние 5 лет позволило Турции войти в 3 стран-лидеров по медицинскому туризму. Впереди только США и Германия. Самое тяжелое заболевание. Самые сложные операции. И своевременное вмешательство. Восстановление. И реабилитация. Продолжение рода. Красота и молодость. Весь спектр медицинских услуг вы получите в Турции. Доверьте нам самое ценное – ваше здоровье. Каждый заслуживает свое маленькое счастье, но не всем это удается. У 5% мужчин и женщин, у 48,5 миллионов пар диагностировано бесплодие. Эта проблема острым вопросом стоит в современном обществе. И выход есть – это экстракорпоральное оплодотворение. Только в Турции ежегодно проводится более 50 тысяч процедур при успешности около 65%. Почему люди со всего мира выбирают именно это место? Благодаря своим инновациям Турция предлагает новые методики вспомогательной репродуктивной технологии, которые помогают повысить шансы на удачное оплодотворение. Даже у женщин со сниженным овариальным резервом. Индивидуальный подход и подбор протокола для каждой пары с использованием прогрессивных методов ЭКО. В случае истощения овариального резерва или наличия мужского фактора бесплодия также существует возможность донорства. В программе донорства участвуют только сертифицированные доноры, проверенные на наличие инфекций, генетических и психологических заболеваний. В случае необходимости проводится предимплантационная генетическая диагностика, позволяющая исключить генетические нарушения эмбрионов и достигнуть главной цели – рождения здорового малыша в семье. Ведь каждый заслуживает свое маленькое счастье. И никаких «но».
Ladies and gentlemen, we come to the last day of the events. Turkish Healthcare Travel Council online exhibition and conference. Within the 3 days, the buyers, the visitors, and the exhibitors has conducted thousands of meetings in order to build a partnership, in order to build a cooperation, to work together closely, that they can serve their patients and citizens who are suffering and looking for higher quality of treatment and affordable cost and affordable treatment as well. So I'm really happy that having you all as our visitors, and I wish that you can continue your communication with our exhibitors after the online exhibition as well, that you can able to benefit more and more with this collaboration and with this partnership. As we have mentioned it in our guideline and the roadmap for cooperation, you have several options of cooperating together with our exhibitors or with Turkish Healthcare Travel Council. As we mentioned that we have in so many countries and so many cities of Russian Federation and CIS countries, our network offices, Turkish Healthcare Travel Council, THTC network offices, close to you. You have the choice of dealing with them and building the partners, and you can come and network doctors and network agent to Turkish Healthcare Travel Council, and other options that you can deal directly with our medical tourism facilitator and travel agent. You can build a partnership together. And the third option that also you can deal with clinics and hospitals directly in order to cooperate and build a partnership. That's up to your choice. What really give you more comfort. You can choose one of this way of cooperating and getting alliance together with our supplier and with our industry in order to working together to be a win-win collaboration, that every party to be a winner and happy with the work that and the time that they consume for this particular medical tourism cooperation and partnership. So medical tourism is growing and becoming more and more popular because people are looking more better location, affordable cost for the treatment. So anyway, the industry will gonna grow, will gonna become bigger and bigger, and always there will be a request from your citizens, from your colleagues, from your family members to travel abroad in order to get best treatment and best option for their health and also best prices. So within this platform, we try to integrate and introduce you each other last 3 days, that you can build the fruitful and win-win cooperation in between you, the participant, visitors, and exhibitors. We will keep in touch with you continuously. We will share newsletters, the development of Turkish Healthcare Travel Council and Turkish Healthcare development. We will share with you continuously. We will update you, and we try to invite you to our events in the other countries. Also in Turkey, when we have offline events, we will try to select among of you to invite and to come and visit our hospitals and our service providers, that you can be able to in touch and see in nature how high quality of hospitals and clinics we do have in Turkey. So you can witness it with your visit. As soon as pandemic problems and restrictions over, we will start also for this info trips and invitation as soon as possible. So once again, I would like to thanks to global marketing team for the organizing, the coordinating of this organization. And we as Turkish Healthcare Travel Council organized this event with the support of Ministry of Trade. Thanks to the Ministry of Trade for their support, and thanks to our technical team, thanks to our PR agency, Global Marketing, and thanks to the participant and also the exhibitor who contribute and who join our events. And thanks to the professor and doctors who join and who give their speech and presentation, and they shared their experience and knowledge with you. And thanks to all, hope that we can see you soon offline or again online. Thank you and wish you healthy and happy future days.